Do you have a strong, frequent need to urinate? Or do you have a burning sensation when peeing? Or probably you have a dark, cloudy, or bloody urine. Then you might have what we call urinary tract. Urinary tract infections are among the most common bacterial infections worldwide, affecting about 150 million people every year. Now, in Nigeria, UTIs represent about 25% of bacterial infections, with women being the most affected. The rise of antibiotic resistant uropathogens, that's microbial pathogens that cause urinary tract infections, also complicates treatments, especially in private laboratory lacking routine susceptibility testing. Therefore, my colleagues and I, consisting of Weme Tengod and Dr. Rosemary Eleke, decided to conduct a study on the prevalence and antimicrobial patterns of these UTIs in our local government area where our university is located, anyway, nearby in Nigeria, from 2020 to 2024, and we decided to do a retrospective cross-sectional design. Retrospective means that we decided to look backwards from 2020 to 24, looking at pre-existing records of about 3,313 patients. However, we selected a sample size of 357 patients and used a systematic random sampling technique to select this medical records. So this is how we did it for each lab. So what did we find? We used a structured proforma to extract the data and of course analyzed it using SPSS version 23 after getting ethical approval. Most of the respondents were within the age bracket of 20 to 29 years, with the least being over 70 years old. We also discovered that female respondents made up more of this population. Now, we discovered the type of UTIs that were prevalent. We looked at both bacterial causes or bacterial pathogens and then fungal pathogens. And you can see that the bacterial pathogens were more prevalent than the fungi one. However, in 2024, we noticed an increment in fungal UTIs, looking at about 8.4%. Fungal infections increased from 1.7% in 2020 to 8.4% in 2024. That is alarming. We also looked at the specific microbial pathogens that caused the UTI infections from 2020 to 24, and we found that the most prevalent microbial pathogen, looking at the bacterial ones, we found that Staphylococcus species was most prevalent. And it's really surprising because globally, E. coli is known to be most prevalent for UTIs, urinary tract infections. But here we found that Staphylococcus species was the highest, followed by Klebsiella species, then E. coli. This may be due to local factors in the environment. We also discovered that Candida albicans was most prevalent, and this rhymed with other global studies. Now, looking at the clinical symptoms, remember what I mentioned at the beginning of this video. If you experienced any of them, most of the clinical symptoms that these respondents had was blood in urine, followed by painful urination, frequent urination, and then abdominal pain. So if you have any of these symptoms, it may likely be to these microbial pathogens. Now, we went ahead to look at the microbial pathogens by sensitive antibiotics. That's the antibiotics that can be used to stop these microbial pathogens from causing problems in your urinary tract. And we found that high sensitivity antibiotics for this problem was ampicillin and then gentamicin. The highest one for resistant antibiotic was ciprofloxacin. So when you want to treat, make sure that you use the right antibiotic to treat your UTI. Looking at the distribution and association of microbial pathogens by age group, we wanted to know which age group had the most common microbial pathogen, and went to check, and we found out that age group between 20 to 29 years, 30 to 39 years, and then 40 to 49 years had the most prevalent microbial pathogen. Of course, for bacteria is Staphylococcus species, and then Candida albicans was also within this age group of having about 3.6% prevalence. So looking at it by gender now, we looked at it by age, now we looked at whether male and female. Of course, females were more in our study and therefore they had more of. As a lady, you are more susceptible to this kind of infection. This means that you have to be very careful where you urinate. If you have any other thing you'd like us to research on, leave it in the comment box below. And if you'd like to see the full paper, check the link in the description box below. Don't forget to like, share, and subscribe to this channel. And see you in my next video. Bye.